Hi, I'm Beth Wahler, and I'm sorry I couldn't be there with you in person, but I'm happy to have the opportunity to present virtually about effective library responses to changing user needs, and specifically looking at the importance of people, programs, and partnerships. I'm going to tell you just a little bit about myself up front. I'm a consultant, a researcher, and a trainer here in the United States. I do some work internationally as well. I have been working solely with libraries for 8 years and have worked with libraries of all sizes, including small rural libraries, large urban library systems, everything in between, as well as statewide library associations and some large regional library groups. My work now, I'm a affiliated research faculty with the University of North Carolina at Charlotte in the East Coast of the United States. I also run a consulting business full time with libraries where I do a lot of needs assessments around either staff stress and trauma or library user needs. I help libraries with developing programs or services to address their user needs or to best support their staff. I also do program evaluation and then training around de escalation, trauma informed library approaches, and leadership coaching or support for supporting staff. I have a book coming out in December that's co authored with my colleague here in the United States, Sarah Johnson, called Creating a Person Centered Library Best Practices for Supporting High Needs Patrons. The title's a tiny bit misleading because the book focuses about half of the time on how libraries can address their user needs, and about half of the book is focused on organizational or leadership approaches that libraries can use for best supporting their staff. Today, I'm going to talk about changing library user needs that we're seeing across the world and how these changing needs are impacting staff everywhere. And then I'm going to talk about possible solutions to these needs and strategies for addressing these needs, including focusing inwardly on employees and how we can support the people in our libraries, adding partnerships, and then adding programming for our users. Just a quick disclaimer that most of what I'm sharing today comes from the bulk of my work, which has taken place in the United States. And I do some international consulting and work with other libraries and am familiar with many of these needs also being there in New Zealand. But I do want to give the little disclaimer that really your cultural context has to be taken into consideration, and there needs to be some local research about the best strategies to use in your communities and libraries. So, there has been a growing body of research looking at increasing psychosocial needs of library users everywhere. And by the term psychosocial need, I really mean any psychological, social, or environmental factor that's related to chronic stress and strain in general populations. And we know over the last decade, and especially over the last 3.5 years or so since the beginning of the COVID pandemic, we've seen pretty drastic increases in many of these needs. And we're seeing increases in these needs in general in our communities. And that's impacting who's coming into libraries and what kind of needs they have in the library. And what we tend to see in library patron or user populations is we see high numbers of people who are experiencing homelessness or have unsafe or unstable housing. We see a lot of users who have mental health challenges, or may have substance use problems and are using substances in the library or sometimes even overdosing in libraries. And we're seeing increases in poverty related needs of library users. These needs, again, have been increasing in general for years, but they've increased pretty drastically or dramatically since the beginning of the COVID pandemic. And although the frequency of these needs varies based on the number of users coming in or accessing a particular library, we do see these same kinds of unmet or undermet needs in rural, suburban, or urban libraries. And many of these needs are trauma related or trauma associated, and they can cause trauma for staff working with people that have these needs. And when I say something is trauma related or trauma associated, what that means is that trauma doesn't directly cause a substance use problem or mental health problem or homelessness, for et cetera, for example. But what we see consistently is that people who experience trauma earlier in their lives are more likely to go on and develop one of these challenges. And then once they have one of these challenges, they're more likely to be exposed to or experience multiple further traumas. So we see this cycle where trauma can predict, the likelihood that somebody might develop a mental health problem, for example, or a substance use problem. And then once they have a mental health problem or a substance use problem, there's a much higher likelihood they'll develop further or experience further trauma, which can complicate treatment for these kinds of challenges or complicate the prognosis. And again, these can cause trauma for people who are working with people who have these kinds of needs because of how they impact somebody's behavior. So in libraries, this is exactly what we're seeing. We're seeing library staff feeling a great deal of stress and strain from the work that they're doing with high needs users and people who have many different psychosocial needs. Staff, when we do needs assessments of them or research with them, frequently describe feeling untrained or not qualified to assist with the levels of need that they're seeing in their library. They also often feel conflicted about what their role is even supposed to be with people who have these kinds of needs, or what the role of the library is even supposed to be. We see that visitors with these kinds of needs often take up an inordinate amount of time from staff, which can make staff feel stretched too thin or overwhelmed or stressed, and can also cause difficulty with meeting the needs of other users in the library. And some libraries have to frequently call police or for more emergency assistance because of the behaviors that are happening in libraries everywhere. We also have a growing body of research looking specifically at library worker trauma related to workplace incidents. And we do see that frontline or public facing library staff from all types of libraries, and again, in all types of communities, so urban, rural, and suburban, report high rates of trauma from workplace incidents. And in my own needs assessments, I've seen that over half of staff report experiencing violence in their jobs, either firsthand violence or witnessing the violence happening or occurring with somebody else being directly victimized. These incidents that are happening in libraries include verbal abuse, physical aggression, and actually being attacked by somebody, threats of violence, being sexually harassed, being threatened with weapons, and having somebody come in and destroy library property. These incidents have increased again since the beginning of the COVID pandemic, when libraries reopened after initial shutdowns, and library staff were often left to enforce COVID related restrictions like masks or social distancing. We saw then that these incidents, these behavioral challenges, really increased at that time. And even after those COVID related restrictions went away, the behavioral challenges have remained. The current political climate, especially in the United States, but it has spread other places around the world, is also contributing to some of the violence and stress and trauma that library staff are feeling. There have been, huge increases in many different places in either threats of violence or actual violence towards library staff around diversity focused collections or programs that are offered. And because most of these threats of violence or actual violence that's happening related to the political climate are targeting programming or collections or events around diversity, such as LGBTQ plus issues or race and ethnicity related issues, then we see that staff who are from those particular groups are experiencing even more trauma because of those incidents. And threats of violence and then actual violence happening with library staff can cause staff to experience either the initial symptoms of a mental health problem that wasn't there before, or the worsening of a pre-existing mental health condition that they may have. When we look at library staff groups who have experienced trauma, we see some pretty common behaviors. We see staff who describe feeling really burned out, who are depressed or have symptoms of depression. We see staff who feel like they're no longer effective at work, who may dread coming to work, may call in sick frequently or show up late a lot. We see staff who isolate and stay away from other people, don't really want to socialize. We see staff who may come across as rude or very irritable, who really are frustrated or say they hate working with people. We see staff who once were really creative, but may have lost that creativity or may have trouble focusing or concentrating. We see staff who have trouble sleeping or who may use unhealthy coping mechanisms like overeating or drugs or alcohol use. And we see staff who have trouble setting healthy boundaries with others. And these are all really normal trauma responses that we see in staff who are experiencing work-related trauma. We also have seen increases in staff who are describing what we call secondary or vicarious traumatization. And so, secondary or vicarious traumatization is when somebody experiences symptoms of trauma or a trauma response or symptoms of post traumatic stress disorder. And they experience these symptoms not because they've experienced the trauma firsthand, but because they're working so closely with other people who have been traumatized. And secondary trauma is really a common occupational hazard for lots of different helping professionals, including healthcare, social services, and library workers. And the risk of developing secondary or vicarious trauma is greater for people who are women, who are highly empathetic by nature, who may have experienced another trauma earlier in their life, who are untrained or undertrained for dealing with other people's trauma, and people who are socially or organizationally isolated. And when we think about library staff groups, we commonly see that people are highly empathetic by nature and are commonly untrained or undertrained for dealing with other people's trauma. So the threat of developing or the risk of developing secondary trauma can be very high. And secondary traumatic stress really impacts somebody's well being and their mental health and can make them feel really hopeless about work and can make them feel disengaged at work or lead to turnover or leaving their jobs or leaving the field altogether. We also are seeing high rates of burnout in library staff right now. And the definition of burnout, it's right here in quotes, and this is the definition that comes from the World Health Organization. And I want to come back to it in just a minute. But the definition is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. And there have to be three different components for somebody to technically be burned out. One is that they have to feel exhausted. The second is that they have to have increased negativity or cynicism about their job. And the third is that they have to actually have reduced effectiveness at work. And the risk of developing burnout is increased by having a lack of control at work, not having adequate resources to do one's job, having unclear job expectations or roles, having dysfunctional work dynamics, for example, working in a place where they don't feel comfortable being themselves or they don't feel comfortable speaking up when something inappropriate happens, being isolated or lacking social support either at home or elsewhere, and then having a work-life imbalance. And this one's a little tricky because what we see is the higher people's stress level gets at work, the lower their energy level is for things that they used to do that were enjoyable, or their lower energy level they have for social relationships, etc. So as stress level increases at work, we really see that work-life imbalance grows. Now, when I said I wanted to come back to the definition, it's because this definition is a very individual definition. It really focuses on the individual and it makes it sound like it's the individual's fault that they're burned out. So when we see that this results from having chronic workplace stress that's not successfully managed, it makes it sound like it's my problem that I didn't manage my stress. But when we actually look at these risk factors, these are organizational, for the most part, organizational risk factors. And that's actually good news because it means for libraries, there are things we can change at the organizational level that can then impact the burnout rate that we're seeing in our library and can reduce the burnout that our staff are experiencing. When we have high rates of burnout happening, what we see is really low morale across our staff and people who are really disengaged from work. And again, burnout can impact whether or not somebody leaves the field altogether, or whether they leave their job for another job. So all of these things, whether we're talking about firsthand experiences with trauma that are happening in the workplace, secondary or vicarious trauma that people may experience, or burnout, these are all really complex and interconnected issues which require broad organizational strategies to address. And so I'm going to talk today about three different things that are part of that broad organizational strategy to for libraries to address stress and trauma and burnout. And those are by focusing internally on employees and the people in our organizations, focusing on where we can develop additional programming to serve our users, and where we can develop effective partnerships to help meet some of these needs. So, first, I want to talk about how we can support the people in our libraries. One of the challenges that's facing libraries is that they were never set up for the kinds of work that's actually happening. Libraries were never created to be internally focusing, and instead, they're very externally focused. And when we think about how libraries were started, it makes sense. Libraries were created focused on the collection and how we could organize the collection, store the collection, and circulate the collection to other people, and how we can serve our communities. And again, the policies, the procedures, and the practices were never really focused on taking care of the people in our libraries, but to really address staff stress and trauma and respond to these changing user needs that we're seeing, we have to focus internally just as much as we focus outwardly. So we have to make changes, and sometimes these can be little changes, sometimes they can be really big changes depending on the specific library. But we have to make changes and make revisions to make sure it's clear that people matter most. If we don't take care of our people, we can never take care of the users that we have accessing our spaces and accessing our collections. So we have to work to create a culture of care in our libraries with everybody, where we're really focused on how we can build and maintain relationships across staff, between staff, thinking about how we can develop relationships between staff at all different levels. We want to make sure that we reduce the hierarchy as much as possible. Libraries tend to be very hierarchical organizations, and we have to be mindful of how the different levels we have in our organization can impact people's ability to be or feel safe in that library, can impact somebody's ability to speak up when something's going wrong. We have to try to reduce the hierarchy as much as possible. And we may need a hierarchy in terms of roles. We may need to clarify roles and have different levels of positions for the actual functions of a person's job. But we need to make sure that when we think about how communication is happening, that that's where we're really working to reduce that hierarchy when possible, and that we create all of these avenues for communication between people at all different levels, so that the people at the top of the organization are making decisions informed by the people who may be lower in the organization, and there's open communication at all levels. We want to make sure in our libraries that we examine policies that we have. Again, because libraries were created to serve others, and again, weren't really set up thinking internally, many policies and practices that we have are really focused on our consumers and our users. And we have to revise policies sometimes to make sure that we are adequately protecting and supporting our employees as much as possible. We also want to make sure that we're addressing problematic workplace behaviors of our employees, and that our policies and practices really offer support to people who are experiencing bullying or harassment or abuse by coworkers or their supervisor, and that there are clear mechanisms for handling these things and reporting these things when they happen. When we look at research on staff stress and trauma, what we see consistently is that yes, much of the stress and trauma is caused by user behaviors that are happening. But in every needs assessment or study on staff stress and trauma, we are also seeing that there are some staff who are experiencing bullying and harassment by either coworkers or their supervisors. So we need to make sure, again, we have policies and practices in place to address that, and that we don't tolerate that in our libraries. We want to make sure that we are using shared decision-making protocols, and that we improve transparency in our libraries so that we are clear about what information we're gathering to make decisions. We're communicating those decisions, that people at the top aren't making the decisions on their own. And again, because we've worked to reduce that hierarchy, there are avenues for people at all levels to give input and feedback that will inform decisions made. We want to make sure, if you think about the burnout slide, one of the risk factors for burnout was having unclear job roles or expectations. So we want to work really hard to make sure we are clarifying roles and expectations and responsibilities of everybody, and that all employees are clear about their roles and specifically their responsibilities when it comes to high needs users in the space. We want to also normalize talking about mental health. So, in our communities everywhere, we frequently talk about physical health without even thinking about it. We may mention that we have a headache or that our back hurts or that we just had COVID or the flu, but we don't talk as openly about mental health. And what we know is that these user needs, these changing needs, and the stress that that causes impacts the mental health and wellness of everybody working in the library. We are not machines. Like, we are all impacted by the work we're doing, and then how we act impacts the way other people respond or the way other people perceive us. And so we have to talk about mental health. We have to talk about how work impacts our overall mental health and well-being and talk about this openly. We want to normalize that. We also want to think about how we can offer debriefing after crises that happen in the library or significant events. My wording here is really important. We want to make sure we offer debriefing, but we don't require it. So some people, when they experience something that's stressful or traumatic, benefit from talking about it and processing it. Other people may find that their trauma response is actually worsened, that they experience heightened trauma when they're forced to relive something or talk about it. So we want to leave the option up to employees about whether they participate in debriefing or not, but we want to make sure we offer that. And we also need to make sure that whoever's facilitating that is trained, because debriefing after trauma or a high stress incident can bring up a lot of difficult emotions. And if somebody is not trained to manage that well, they can actually do damage or harm to employees. We also want to think about sustainable practice, which is a term that Neonow and or Zetterval and Neonow use in the book Whole Person Librarianship, which is how we take the burden off the individual. We don't think only in terms of self-care and how somebody can individually take care of themselves, but instead we look for ways we can incorporate wellness-focused strategies and activities in the workplace. And that, again, because burnout and stress and trauma is not solely caused by individual factors, that we don't put the onus on an individual to solve it for themselves. And we remember that we're all in this together and we're all part of a community, and our library has to implement strategies as a whole to address this. One of those is the next bullet, which is about thinking through opportunities for reflective practice. So reflective practice is creating different avenues for people to process work incidents, but also to reflect on how we can improve. What is it that we need to get better with these things? Do we need training? Do we need to make policy changes? Do we need a change in our practices? So reflective practice is creating opportunities in our schedule in the workplace for staff to gather either as pairs or in groups, and to talk through some of the workplace incidents that happen, and then also reflect and figure out how to keep moving forward with skills and strategies as a library to address these things. We also want to make sure, as we're focused internally on our people, that we have plans in place for psychological emergencies just as much as we do physical emergencies, so that every employee knows how to effectively respond no matter what kind of crisis happens in the library. Something really helpful for this is Mental Health First Aid International. It's an evidence-based intervention for people who are not mental health professionals, to help them know how to recognize a mental health or substance use-related emergency and how to get help or how to respond and intervene in those instances. And so sending your management team or having your staff trained in mental health first aid can be helpful to inform your own psychological response plans for these kinds of emergencies. And then don't be afraid to request consultation or support as needed as you figure out how to revise things internally to best care for your people. The next thing I want to talk about is adding relevant programming. So thinking about how we can do programming and offer programming to address these changing user needs and help reduce the impact of some of them in our libraries. libraries are really well poised to offer programming that's aimed at mental health and overall wellness, specifically addressing some of the low levels of need, focusing on prevention or teaching self management strategies to prevent people from having worsened or heightened mental health problems or physical health or other challenges. So, with mental health, we see a lot of successful programming in libraries focused on teaching resilience, mindfulness, yoga or Tai Chi, stress relief strategies, etc. We see programming that is focused on helping people recognize common mental health problems or recognizing substance abuse problems when they begin, and what somebody could do if they think they're developing a problem or if they know somebody in their lives who is developing a problem. Offering programming focused on community resources can be really helpful, or even allowing library space to be used for support groups or mutual aid groups around mental health and wellness. Hosting mental health focused community partners, which kind of segues into the next slides here in a minute. But that can be really helpful so that that community partner is coming in and offering the mental health focused programming or meeting directly with users who have mental health problems to help link them to other services in your community. For wellness, overall health and wellness, effective library programming involves offering programming focused on diet, exercise, blood pressure, weight management, mobility, looking at early indicators of developing health problems and strategies for self management, or again, preventing the worsening of a health problem. Support groups around physical health can be really helpful in a library. Community resources for overall health and wellness are another important focus of programming. And then actually offering either on-site food giveaways or assistance with basic needs is really helpful for addressing physical health and wellness. And these can be done in collaboration with community partners. So again, that segues nicely to the last piece, which is about supporting library staff and users through strategic partnerships. So there is so much pressure in communities everywhere on libraries to be all things to all people, and on the library staff to somehow have all of these skills to be educators and nurses and social workers. And we can't expect that. That's not a realistic expectation for people working in libraries. And instead, we really need to focus on developing partnerships between a library and other specialists in the community who can come in to offer some of these programs and services that users need. So, as a library, that takes a lot of time and intention and effort. But we have to think about what we need to do to build our collection of relationships with relevant community partners to address whatever the biggest needs are that we're seeing in our user populations. So if we're seeing a lot of mental health needs in our users, then starting with some sort of partnership with a mental health serving organization. If we're seeing a lot of poverty related needs, then really seeking out different providers in our community of financial assistance or food assistance. And really looking at what we're seeing as the biggest needs in any individual library, because those differ based on different communities and the resources that are there. And then really going through the effort to build and maintain a successful collaboration so that somebody who's an expert in those needs is the one that's coming into the library or helping to develop or offer an intervention or a program that may be offered in the library space, so that we're not expecting library staff to become experts in all of these things. Now, successful collaboration takes a lot of time and commitment and dedication. It's not easy. And these often have to be developed by the library. You know, the community partners don't always come to you because sometimes they aren't aware of what you're seeing in the library as your needs. And so it may take you going out and initiating these and explaining what you're seeing. But again, it's worth it in the end because it can help not only support the needs of high needs users, but can also support staff and reduce some of the strain on staff in our libraries. So really look at your own libraries and think about what strategies you may need to use to focus internally on improving support for the people working in your library, whether adding relevant programming focused on mental health and wellness is important and needed for your users, and then also thinking how you can develop strategic partnerships with community partners, community resources to help address these needs. So I appreciate all of you attending this presentation. You've got my email and my website here. If anybody has questions after this presentation, please feel free to contact me directly. You can also find out more information about my work, some of my publications. I have some publicly available infographics and toolkits that may also be helpful there at my website. So thank you for attending. I really am very grateful for this opportunity.